So these are the questions from respiratory system. First question, a nurse is caring for a child with a diagnosis of cystic fibrosis and pneumonia. The plan of care include nebulizer treatment and physiotherapy. The nurse should perform chest physiotherapy when? Continuously during the nebulizer treatment, prior to the nebulizer treatment, after the nebulizer treatment, and intermittently during the nebulizer treatment. Remove the wrong answer first and then select the correct answer. So what is the wrong answer here? Continuously during nebulizer treatment can be wrong, that can be removed, and intermittently during nebulizer treatment. These are the two wrong answers. Either before nebulizer treatment and after nebulizer treatment. So usually chest physiotherapy should be performed after nebulizer treatment. So the correct answer for this is C. Okay. And what is cystic fibrosis and what is pneumonia? What is pneumonia? Yes. Say the answer. Yes, Binu.
Pneumonia is a lung disease caused by viruses such as Staphylococcus, Klebsiella,
The virus ano?
or
Bacteria.
sorry, bacteria. It is aerobic and lobar pneumonia. And cystic fibrosis affected digestive system and lungs. It is a hereditary disease.
Okay, so it is an autosomal recessive disorder in which exocrinal dysfunction may occur. Okay, exocrinal function of exocrinal autosomal recessive disorder is infection of pneumonia. Okay, so infection of lung parenchyma is pneumonia. Fine. So what is the peculiar sign of pneumonia, Gina?
Yes, just one.
What is the sign of pneumonia? You can say early sign and later sign. Yes.
Initial sign is high fever.
Fever and chill is the clinical sign. Yes, yes, Gina, you can say the answer. Deepan and Chodikada, mic off.
Madam.
Okay, okay. Gina, Pare.
Initial sign is fever, chills, fatigue, weakness. These are the initial signs occur in the client, and later. Later the patient will.
What is a peculiar sign? Pneumonia peculiar signs apart from temperature. What about the sputum?
The sputum is very.
See, whenever you get a question, something related with the pneumonia, you have to just imagine it is fluid accumulation within the alveolar space and it causes thick exudates and gas exchange alters. And ultimately, these secretions will be expelled out in the form of cough and with sputum. So the color of the sputum always determines the affected site of pneumonia, like means where is the properly affected area, whether this is on the bronchial area or if it is on the lobar area. And again, if you just auscultate also, you will be able to identify the location But by simply identifying the signs and symptoms itself, you will be getting a clear picture. Almost ഒരു 70% clear ആവും എവിടെയാണത് ഏതാണ് ഇതിന്റെ പൊസിഷൻ എന്നുള്ളത് by looking the color of the sputum. Fine. So sputum examination will help to identify the type of pneumonia, as well as that will help to identify the organism which is causing pneumonia. So please remember, there are two main type of pneumonia based on the affected position: bronchial pneumonia, lobar pneumonia. Bronchial pneumonia is caused by strep infections mainly. Lobar pneumonia is caused by pneumococcal organism. And what is the difference between this color of sputum? Color of sputum in lobar pneumonia is dark rusty colored sputum, whereas in bronchial pneumonia it will be greenish yellow. Okay, greenish yellow colored sputum. And see, as a result of this, when the alveoli get like this is alveoli, and the secretions get accumulated in the alveoli, and it later on causes a thick exudates. Fine. So as a result of this, the gas exchange alters. So what is your goal of treatment, or what is your aim while planning the treatment? You need to remove the entire thick exudates from here. Okay, so entire thick exudates need to be removed. How do we remove this? By hydrating the client. You can hydrate the client, and that will help to thin the secretions. And by performing chest physiotherapy, you can mobilize the secretions. Okay, appo pneumonia eppozhum varuna questions aanu mainly orthirikka. What is the physiology of pneumonia? Secretions will be formed in alveoli, and it become thick exudates. What is thick exudates? It is thick exudates nu പറഞ്ഞാൽ ഭയങ്കര കട്ടിയുള്ള secretions ആവുക. That alters the gas exchange. Okay, so the answer for this question is after nebulization. After 15 minutes of nebulization, you can write down that too. After 15 minutes of nebulization, chest physiotherapy is possible. Fine. What is the position for chest physiotherapy?
Lean forward.
Yeah, you can
forward.
sitting with a lean forward position, or you can provide any positions. Fine. Mainly sitting with a lean forward position. Okay, so after giving the answer, you can just turn off your mic. So already we said, like a cystic fibrosis, it is autosomal recessive disorder. The number one is autosomal recessive disorder. Second thing is an exocrine gland dysfunction. As a result of that, all exocrine secretions get accumulated inside the exocrine gland. For example, one exocrine secretion is a mucus secretions which is found in the respiratory system. For example, respiratory system korchu mucus undu. Globate cells produces mucus, and the mucus is found everywhere in the respiratory tract. These produced secretions will not be expelled out. So as a result of that, what happens? The secretions get accumulated, and it causes inflammation. Look at the picture there. The first airway, which is given as a normal airway, and second airway affected with the cystic fibrosis. And in case of cystic fibrosis, what happens? Secretions get accumulated over there, and because of accumulated secretions, it cultivates the organism, and it increases the chances of respiratory infection. So for a patient with a cystic fibrosis, there will be chances to get all kind of infections like laryngitis, bronchitis, laryngotracheobronchitis, all kind of infections like any asthma, pneumonia, all kind of infections will be an expected thing. So all signs and symptoms which is related with the respiratory disorder will also be associated with this client. Okay, so please look at the signs and symptoms of cystic fibrosis. There'll be fatigue, chronic cough, recurrent upper respiratory infections, thick sticky mucus, chronic hypoxia. See, what is the sign of chronic hypoxia? If a client is chronic hypoxic, not acute hypoxic, chronic hypoxia. What is the difference between chronic hypoxia and acute hypoxia? Chronic hypoxia എന്ന് പറയുമ്പം chronic situations ആണ്. The patient has been hypoxic for a long period. Acute hypoxia, the patient become hypoxic just now. Okay, so that is the difference between chronic hypoxia and acute hypoxia. Acute hypoxia, the problem is which is started recently, but in chronic hypoxia, the problem has been there for a longer period. Fine. For example, COPD is causing chronic hypoxia. Acute bronchitis is causing acute hypoxia. Clear. And coronavirus infection and pneumonia is causing acute hypoxia. It is for a shorter duration. Fine. And so there anemia, chronic anemic situations will cause chronic hypoxia. Fine. So in chronic hypoxia, there will be chances to get a clubbing of fingers. That is a classical sign. And there will be barrel chest. Okay, the chest circumference alters and the chest will look like a barrel. And decreased absorption of vitamins and enzymes, abdominal distension, decreased digestive enzymes. So what are the digestive enzymes? See, amylase and lipase and pepsin, trypsin, all these kinds of digestive enzymes are normally produced by the pancreas. So pancreas is necessary to produce and release digestive enzyme. Pancreas is also considered as an exocrine gland. So what happens as a result of this cystic fibrosis? As a result of decreased exocrine gland function, pancreatic enzyme won't be normally coming to the small intestine. Okay, so digestive enzyme deficiency will be happening like amylase and lipase excretion is reduced in this, and that ultimately reduces the vitamin absorption and enzymatic or metabolic variations. That is the expected thing. So decreased digestive enzyme, so that which means amylase, lipase will be reduced, and decreased amylase causes protein malabsorption, and decreased lipase will also causes fat imbalance, like a decreased metabolism of the fat. Okay, and the fat will be excreted through the stool because the fat is not normally getting absorbed, so it causes steatorrhea or a fatty and stinky stool. Fine. So this is the signs of cystic fibrosis. All the first symptoms up to this is a sign which is related with the respiratory system. Okay, this is the sign which is related with the respiratory system. Okay, and how do we manage? Provide calorie and protein rich diet. Pulmonary therapy. What are the pulmonary therapy? Nebulization, hydration, chest physiotherapy, deep breathing, coughing, exercise. Okay, so that is included in pulmonary therapy. Chest physiotherapy, postural drainage. Already we have discussed the postural drainage. What is postural drainage? By providing different position, you will be removing the secretions from the lungs. Fine. And breathing exercise, aerosol therapy. What is aerosol therapy? It is nebulization or using puff. Okay, so these are the treatment and medications like antibiotic. Why? Because the patient will be having infections. So antibiotic, supplemental vitamins. Why? Because the metabolism is not properly. And aerosol bronchodilators. Why bronchodilators? See here, there is a bronchoconstriction. Okay, bronchoconstriction to be treated by bronchodilators. Mucolytics. Why? To thin the secretions. Pancreatic enzyme. Why? Because pancreatic enzyme is less here. Okay, and main classical hallmark sign of cystic fibrosis is the salty taste on a skin. Salty tasted skin. If possible, you can just remember this particular picture. The child is having salty snacks on his hand and one bottle with enzymes. So how would you treat cystic fibrosis? You have to provide vitamins and minerals, and to stabilize the metabolism properly, you can provide enzyme. What enzyme? Pancreatic enzyme. Okay, so you can provide pancreatic enzyme. And what is a basic sign of cystic fibrosis? Is salty taste on a skin. See, look at lungs. There is fluid in the lower lobe. This fluid need to be taken out. How would you remove this fluid? One, you can just expand the lung and then just turning the patient back or turning the patient down. If you give head low position, the fluid can be expelled out. Okay, so by giving different position, you can remove the secretions. Okay, so please remember, see, you will get minimum 3 or 4 questions from cystic fibrosis. Okay, so next question. A patient with pulmonary embolus and nurse is preparing to obtain ABG. What will be the priority nursing diagnosis? What will be the priority nursing diagnosis? Impaired gas exchange, knowledge deficit, fluid volume deficit, and altered breathing. Pulmonary embolus. Yes, very good. Impaired gas exchange. Okay, fine. What is the cause for pulmonary embolus? What is the cause for pulmonary embolus? Basic reason. Pulmonary embolus in the basic reason is immobility. What is pulmonary embolus? Embolus is a clot, fine, a thrombus. So this particular thrombus is hitting over the pulmonary circulation. Please look at this picture. Either due to immobility or due to obesity, due to DVT, and as a post-operative complication, postpartum patients like after delivery, and the person who is using oral contraceptives, please make a box and write down oral contraceptive. It is type of contraception, and contraceptive medications, oral contraceptive medications, that is OCP, that forms a thrombus. Immobility will also form thrombus as DVT. Obesity, obviously, yes, it may cause thrombus. DVT will also cause thrombus. Post-surgery, as a surgical complication, there will be chances to get a thrombus in the blood vessel. Okay, usually because of these risk factors, what will happen? Venous pooling. If you are not mobilizing your leg properly, there will be chances to get a swelling over the leg. And as a postpartum, post-operative complications and postpartum complications, there will be chances to get a venous pooling. What is venous pooling? The venous blood gets accumulated. Fine. And that causes emboli formation or a thrombus formation. And what happens as a result of this, when this thrombus or emboli that may travel towards the lung. Okay, so if this thrombus is there only at the leg, it will not cause anything. But when this start to travel towards the circulation, it reaches up to the heart, and from heart it will reaches in the lung. And inside the lung, there is a network of the capillaries. Pulmonary artery has a multiple network, and pulmonary vein will also has a pulmonary networks of blood vessels. Why? Because these network is encircling the alveolus and where through the gas exchange take place. Okay, so mainly the filtration of blood, or the main filtration may take place at lungs, and the gas exchange will also take place at lung. So when this thrombus reach in the pulmonary microcirculation, it get obstructed in the microcirculation. Why? Because in the meshwork of the micropulmonary circulation, the blood vessels are very small. So these thrombus, when it moves into the since the blood vessels are very low, it get obstructed over there. So you can just zoom it and see the thrombus. They have denoted as a car, and the car is reached over the lungs, and two cars become like a accident or collision, and that is obstructing the pulmonary blood flow alteration, or obstructing the pulmonary circulation in the microcirculation. So what happens as a result of this? When the blood supply is obstructed, the gas exchange is not going to happen properly. So gas exchange will be reduced. So as a result of that, oxygenation will be reduced, and it causes hypoxia, it causes tachypnea, it causes decreased oxygenation, increased carbon dioxide level, and chest tightness will occur, and hemoptysis. That means the blood will come through the sputum, and the patient will start to cough, and chest pain. So the patient suddenly complains shortness of breath, chest pain, chest tightness, and hemoptysis. That is indicating that the patient is having pulmonary embolism, and along with this there will be chest pain also, severe stabbing chest pain. And see, pulmonary embolism is not a chronic condition, whereas this will happen within no time. For example, if patient has any of this risk factor, when they start to move or when they start to mobilize their leg, the thrombus will be dislodged immediately, and that will reach ultimately within fragment of second, it reaches over the lungs, and it causes sudden hypoxia. Fine. So this is something considered as a lethal condition or a life-threatened conditions. So you have to treat the client immediately. How do we treat? You can provide a position. See, what is the position that you can provide for this patient is slight head low with a lateral position. That will help to remove the thrombus. Slight head low with a lateral. See, it is not like recommended for a longer duration. If patient has developed any of these kind of symptoms, if you suspect that this is pulmonary embolus, you can provide the position for a smaller while, and if there is no improvement by giving this position, immediately the patient may get collapse. So immediately the basic treatment you need to start to revert the client back, and the definitive treatment is thrombolizing. What is thrombolizing? Distracting the throat by giving heparin. Fine. So this is life-threatened problem, and you can just remember the risk factors. See, what are the questions which is you may get related with this is, see, a client after surgery, patient got discharged, and after discharge, the patient complained sudden chest pain, hypoxia, the hemoptysis, and the patient is anxious, confused. So that may which is these symptoms are something related with pulmonary embolism. So you may get the question like this. Otherwise, you may get the question like patient who has been immobile for 3 months, and by following the proper treatment, the condition has improved, and the patient condition is improved, and the doctor advised the patient to mobilize, and the patient has started mobilizing only 10 steps per day, and while mobilizing, the patient suddenly started chest pain, hypoxia, dyspnea, confusion, and chest tightness. So that is indicating again pulmonary embolism. Next situation is gravida 3, 32-year-old female delivered large baby through cesarean session, and the baby and mother was okay, and they got discharged yesterday. And today I got a call from home by this patient, not by this patient, patient's spouse, and the relative gives a complaints, or describe, the relative is describing the situation that while moving to toilet, she has developed a chest pain, breathing difficulty, and suddenly she was confused and she is not responding. So even this is also indicating pulmonary embolism. Okay, so these are the certain situations where you will get questions related with pulmonary embolism. Clear, are you? See, this is a life-threatened condition, so you will get these kind of questions from critical care nursing. This is the exact pathophysiology of pulmonary embolism. Please look at the picture from the leg, DVT, the thrombus is dislodged and it is moving to the heart, and it has reached over the heart. From the heart, with the help of pulmonary artery, from right ventricle, the blood is pumped into microcirculation of the respiratory tract. See here, the clot got obstructed here. See, there is an obstruction. As a result of obstruction, the blood supply is reduced throughout this area, and the color change, the color is changed and it become hypoxic. Clear? Yeah, this is pulmonary embolism. Next question. You can read the question. Read the question and please drop your answers in the chat box. While caring a patient in a post-anesthesia care unit, a nurse observed the onset of rapid breathing, cyanosis, and narrowing blood pressure. The nurse should plan to administer bolus glucose, suction the airway, turn the client to right side, administer intravenous fluid. Remove wrong answer first, then select the answer. See, I will help you to remove the wrong answer. Administer bolus glucose is not required. The situations where A can be removed, and administer IV fluids is not recommended. So if you want, you can remove yeah, D or C can be removed. Turn the client into right side is a wrong thing. Yeah, A can be removed and C can be removed. Then what is the answer? See, I'll explain the situation. The patient is there in the post anesthesia care unit where the patient won't be completely conscious. Fine. And on this particular moment, the patient has developed rapid breathing, cyanosis, and narrowing blood pressure. Rapid breathing and cyanosis is indicating hypoxia, and during surgery, usually the surgery was done with the help of anesthesia, and normally this might be done with the help of general anesthesia. Usually while general anesthesia, you will administer certain medication, and that medications are muscle relaxant. So as a result of muscle relaxant, the entire muscle of the patient will be relaxed during the surgery, and the patient's interpretation regarding pain stimulus, all those things will be reduced. So patient won't be knowing the sensations. Okay, regarding the pain stimulus or whatever. So that is a positive effect of anesthesia during the surgery, and which is very necessary. After surgery, we will not be continuing the anesthetic medications. We have withdrawn from the anesthetic medications. So when we stop the anesthetic medication, the muscle relaxation should also revert back to the normal. It will take time. In certain group of patients, the muscle relaxation or the strength of the muscle immediately regain back soon, but there are certain situations where the regaining ability will be decreased. Okay, so as a result of anesthetic effect, there will be lack of coughing reflex, there will be lack of respiratory muscle strength, there will be lack of cardiac function, there will be lacking of peristaltic movement, there will be lack of muscle strength in the lower extremities. So immediately after surgery, the patient is not going to walk immediately with running and walking. The patient will be having a problem. And see, external regaining muscle strength will be it happens immediately, but in case like an internal thing, internal muscle functions regaining will be much delayed. It will take time, 1 hour, 2 hour, 3 hours, or maximum up to 6 to 12 hours. Okay, it depends. Okay, so again, the respiratory strength, the respiratory muscle strength is also reduced, and as a result of that, the secretions will be accumulated in the respiratory tract. Clear? And this is basically because of the accumulation of secretions in the respiratory tract. The patient has developed a cyanosis, rapid breathing, and narrowed blood pressure. So the accumulated secretions need to be removed by suction. So the correct answer for this question is suctioning the airway. So during post-anesthesia care unit, you have to closely observe. See, these kind of questions you will get from a respiratory system, as well as you may get these type of questions from the surgical nursing. Okay. So when the patient is there in the recovery room, you have to monitor airway. You need to monitor level of consciousness of the patient. See, if patient has consciousness, the patient will call you. If patient in a conscious undingle, if they has any symptoms, they'll just, at least they may press the bell if they has consciousness. But if they don't have conscious and patient is semi-conscious, they won't be able to call you and inform you regarding any of symptoms. So you have to monitor the client very closely. Fine. So airway need to be assessed, the level of consciousness need to be assessed, and you can just predict, or you can just suspect that the patient may develop any of respiratory obstruction. So throughout these period, like immediate surgery or in the recovery period, you need to monitor respiratory rate and coughing ability, and you need to provide a lateral position for this client. Okay, why lateral position? The not body, entire body lateral, only the head turn to be one side. The body can remain in the same position, in the supine position, but the head can be slightly turn to the one side, because as a result of the effect of general anesthetic medications, there'll be chances to get a vomiting. Anesthetic medications causes vomiting sensation also. So during this particular period, the patient may vomit. So if patient has patient vomits, and it may move into the respiratory tract. So in order to prevent aspiration, you can just provide lateral position. Okay, so yeah. Once patient is conscious, you can provide a semi-Fowler's position, because that will always help to open the airway. But a semi-Fowler's position is only possible when the patient is awake, or when the patient is conscious, fully conscious. Fine. So the correct answer for this question is suctioning the airway. Ramya, Neetu, confusion undo? Okay. Ipa clear ayo?
Yes, ma'am.
And Binu answer.
Yes, ma'am. Clear.
Okay. Fourth one, while caring for a patient with ineffective airway clearance related to increased mucus production, the nurse should encourage fluid. So what is the choice of treatment for ineffective airway clearances? Question tanna tannittundu. What is the treatment for ineffective airway clearance? It is encouraging fluid. You can write down ineffective airway clearance. The choice of treatment for this is encouraging or hydrating the patient. So the question is, why this is important? Drop your answers. Okay. Very good. D, thin the secretions. Okay, okay, fine, fine. Okay. So the answer is D, thin the secretions. Okay. And I want all of you to write down the nursing diagnosis. You can just put a hyphen and write ineffective airway clearance. Just put a hyphen and write ineffective airway clearance. Below that, this particular nursing diagnosis will be considered as a primary nursing diagnosis of which of the conditions? Ineffective airway clearance related to increased mucus production. That can be considered as the priority nursing diagnosis for which of the conditions? That is a question. Manslayo? Asthma, pneumonia, cystic fibrosis, pulmonary edema. For all these diseases, you can create priority nursing diagnosis as ineffective airway clearance. Cystic fibrosis, asthma, pneumonia, pulmonary edema, and COPD. Okay. What is the first management in ineffective airway clearance? What is the immediate nursing intervention? That is encouraging the client, encourage the client with a fluid. Next, fifth question. The patient with advanced lung cancer is exhibiting cyanosis and edema of upper and head and upper extremities. Which of the following intervention would most likely provide an immediate benefit for this patient? Place Trendelenburg position on the right side, elevating the head end of the bed, and elevate extremities. There is edema over the head and upper extremities. If patient has edema over the upper extremities, you are not supposed to provide head low position. That means you can remove A. Position on right side, there is no relation with that. Elevating the head end of the bed can be. Elevating the extremities. If it is lower extremities, edema is on lower extremities, you can elevate the extremities, but this is on upper extremities. So the answer could be elevating the head end of the bed. So C is the answer. Okay. Sixth one. Nurse is administering tuberculin skin test, purified protein derivative. Which of the following time frame should the nurse tell the patient to return to the clinic for the test to be read? After giving purified protein derivative, you have to ask the client to return to this clinic for reading the test. Yes, the answer is 48 to 72 hours. Okay, so the correct answer for this is D, 48 to 72 hours. Okay, fine. So tuberculin test or Mantoux test is a test to identify pulmonary TB. Neetu Varghese.
Yes, ma'am.
Neetu, what is a confirmatory test to identify pulmonary TB?
Open for AFB.
From AFB. Okay. When would you collect the sample? When would you collect the sample?
Morning.
Early morning sample. Okay, fine. Before collecting the sample, whether you need to wash your mouth or brush your mouth or use gargle by chlorhexidine, what is important? Never use brushing, and never use gargling with any antiseptic solutions. You can only gargle, symbol with water. You can just once gargle and collect the sample. Yes, Neetu. How do you do this test, the tuberculin test? This is a test same as allergic test.
For giving skin test subcutaneous.
Subcutaneous. Subcu ആണോ? ഇത് പഠിച്ചു പണിക്കരാവുകയാണോ? Usually you will give PPD, purified protein derivative. എങ്ങനാണ്? Where would you give and how would you give?
We are giving in skin.
അതെ മക്കളെ, അത് ഏതാണ്? സബ്ക്യൂ ആണോ, ഇൻട്രാഡേമൽ ആണോ, എങ്ങനെയാണ് അത് കൊടുക്കുന്നത്? ഇൻട്രാഡേമൽ. തെറ്റിപ്പോരുത്. ഇൻട്രാഡേമൽ on the forearm, okay, which is highly sensitive area, and then you have to monitor in duration, okay, and the time duration should be like maintained, that is 48 to 72 hours. Okay, and Neetu, what is the ankle for giving this injection? We said it is intradermal, so you have to select the ankle for intradermal. Intradermal injection kodukumbo, what is the ankle?
20 to 30 degree.
എനിക്ക് ക്ലിയർ അല്ലടാ പറഞ്ഞത്.
20 to 30 degree.
20 to 30 degree. No. Intradermal എന്ന് പറഞ്ഞാൽ 20 to 30 degree ഉണ്ടോ? See, we'll be just holding the syringe in a, like for example, if this is skin, we will be like giving the or holding the this is like this. Hello. This is almost yes,
15 degree.
10 to 15 degree is the angle. Get on. Then, okay, what is the needle gauge?
26.
26 or 27. 10 to 15 degree ആണ് intradermal angle. Okay, so this is for intradermal, and what is the gauge? 26 gauge. Okay, and if this is 45, okay, appo idu edayirikkum? What is this root? Second picture.
Subcutaneous.
Yeah, this is subcu. What is the needle gauge?
26.
This is the third picture.
90 degree.
90 degrees. So it is for
23.
IM. Okay. Injection heparin, you can just correlate or you can just connect with which picture, A, B, C. Injection heparin.
B.
B. Okay, insulin.
Then
B.
B. Amikacin. Amikacin. Injection amikacin. Yeah, obviously I have not given IV, so you have to select any other thing. Yes. Amikacin always IM. Okay. And hepatitis B vaccine.
B. A.
Hepatitis B vaccine. IM. So the answer is C. C. IM injection ആണ്. Measles. Sub-Q. Mumps vaccine. Mumps. Root എനിക്ക് വേണ്ടത്. So you can select either A, B or C. It's again sub-Q. So the answer is B. Rubella.
Subacute.
Okay. Then Schick test.
A.
Schick test is to identify diphtheria. Diphtheria antitoxin is given intradermally. Again A. Okay. BCG.
C.
ID sub-Q.
Sub-Q or intradermal can also be given this. Okay. Vitamin K injection for newborn.
Sub-Q.
Yes.
Subcutaneous.
Subcutaneous. Oh, subcutaneous ആണ് കൊടുക്കുന്നത് vitamin K. IM. Should be yeah, it should be IM. Fine. And yeah. So ഈ ഒരു type questions കൂടെ നിങ്ങൾക്ക് വരാൻ chance ഉണ്ട് കേട്ടോ. So please go through the ankle of injection and needle gauge of injection. Okay. 7th question. You can read question number 7, then drop your answers in the chat box. The patient who is scheduled for tonsillectomy is in pre-operative unit. The nurse notes an order for pre-anesthetic medication to be given on call to operation room. The nurse should give this medication when? Already there is a standing order. So please drop your answers in the chat box. Only you can select the answer from 7. So what is the answer? A. Immediately upon being notified. Okay. Ellarde answer ayano. Very good. So the answer for this question, 7th question is A. Okay, fine. And fine. So next situation, the situation is this. Pre-operative client. A client is in pre-operative unit where the patient is posted for surgery X. Okay, and currently the patient is NPO. And before surgery or one day before surgery, you have to periodically monitor vital signs. And you have monitored vital signs and it is noted as 101 degree Fahrenheit. There is a standing order, tablet acetaminophen, SOS, when the temperature is greater than 100 degree Fahrenheit. What is your responsibility? Okay. What is your responsibility? Based on this situation, how would you manage? Okay. So I'll give you the options also. Inform the doctor, administer medication, request the medications as IV and postpone the surgery.
Administer the medicine.
Administer medication.
Administer the medication, all right? Currently, the patient is NPO status. Still medication administration and answer. Patient is
Yes,
not able
still.
to take any fluids or anything.
With sip of water.
Yeah, so only for taking this medications, you can use sips of water, no problem. So the answer for this is only administer medications. ഞാൻ അങ്ങനെ പറഞ്ഞപ്പോ ഒരാൾ ആൻസർ ചേഞ്ച് ചെയ്തു. So NPO status is not like for giving medication, hardly 10 to 12, 15 ml of water is more than enough. So you can administer the medications. Okay. So if there is a standing order, you can just follow the standing order. This is all about question discussion, and remaining questions we will discuss in the next class. And if you have any queries, please feel free to ask me. And this is a discussion sessions now.